mga tanong na maaaring lumabas sa darating na Philippine Nursing Licensure Examination ang alay ko sa'yo for today. Yes, board exam type of questions along with rationalization that will cover your maternal and child nursing. If you want to know more about that, stay tuned. Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students with their studies. If that's something that you are interested in, consider subscribing. If you're already subscribed though, thank you so much for your love and support. I see you. I upload my nursing educational videos once a week. Don't miss it out. Subscribe now. Hit that notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more content like this. Without further ado, nurses, let's jump into the video. Hello nurses, how are you guys doing? Welcome back sa ating another discussion for today. Kasi na nalalapit na yung board exam at I'm trying to, give you review materials na pwede mong gamitin para pagdating ng araw ng board exam, handa ka na. Today is another entry natin sa ating nursing test bank. Yes, kung hindi mo pa napapanood yung mga previous uploads ko about sa nursing test banking, ililink ko yung actual playlist dyan kasama nung iba nating mga nursing educational contents. Possible questions, board exam type of questions that will cover your maternal and child nursing. Hindi ko na patatagalin to. I will need to switch back to my PC and I'll see you guys in a bit. Hi everyone! Welcome back sa ating formal discussion ng iyong maternal and child health nursing. Yes, this is another entry natin sa ating Philippine National Licensure Examination Nursing Test Bank. Now, kung hindi mo pa napapanood yung mga previous uploads ko regarding sa mga board exam type of questions na maaaring lumabas sa board exam natin, kasi alam ko na nalalapit na yan ngayong darating na Mayo, malaking tulong ito kasi ito yung mga tanong na posibleng lumabas at posibleng maulit ngayong darating na board exam. Alright? So, panoorin mo yon. Ililink ko yung actual playlist dyan sa description box or you can actually check out yung icon button kapag nag-pop out yon. I-check mo yon. Ililink ko yung kasama ng ibang mga nursing educational contents na ginawa ko. That's all for you and hopefully makatulong yon sa pagre-ready mo not just for the board exam but sa mga nagtatake ng NCLEX, sa mga gustong mag-refresh, sa may mga assignment dyan. Baka naman, i-check mo yon, makakatulong yun sa'yo. Or kung ikaw ay isang nurse at gusto mo lang mag-refresh, you might wanna go ahead and check that out because it will help you, to refresh and study and learn more about nursing. Okay? Now, hindi ko na patatagalin to. I will share to you our objectives for today. So, I will going to provide you and discuss to you board exam type of questions. Along with the board exam type of questions, I'm gonna give you the rationalization per each question. Now, I want you to take note na kapag ginagawa na natin tong nursing test banking, ang gusto kong i-take mo dito is yung rationalization. Kasi sa board exam at sa kahit na anong nursing examinations, minsan nauulit yung mga tanong, iniiba lang nila itsura, iniiba yung forma, pero same thought. Okay? Now, I want you to really understand and have the full grasp of your rationalization. All right, so let me give you the instructions. How will this rationalization will go? Now, you will be given 25 board exam type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each question. The answer is revealed instantly after each question with rationalization. Choose the letter of the correct answer. Good luck, nurses. Handa ka na ba? Hinga-hinga, maternal and child nursing ito, MCN. Let's begin. Alright, question number 1. A client asks the nurse what a third-degree laceration is. She was informed that she had one. The nurse explains that this is, ano ang tanong? Ina-explain ka, tinatanong ka, definition of terms lang to ng third-degree laceration. Alright, pag masyadong malilito, I hope rin na makatulong ito mga visuals na to na nilalagay ko dito. I'm really trying my best para matulungan natin yung mga visual learners, pati na rin mga auditory learners. Okay? Now, is it A, that extended their anal sphincter? B, through the skin and into the muscles? C, that involves anterior rectal wall? D, that extends through the perineal muscle? Your 5 seconds starts now. Alright, time's up. The answer is letter A. Bakit? The answer is that extended their anal sphincter. Third degree laceration involves all the second degree laceration and the external sphincter of the rectum. Options B and C along with D are under the second degree laceration. Third degree na po. Third degree laceration. Ito siya oh. Ayan. Okay. Alright, let's proceed. Board exam type of question number 2. Bettina, 30 weeks, AOG, age of gestation, discharged with the diagnosis of placenta previa. Keyword placenta previa. The nurse knows that the client understands her care at home when she says, care at home, evaluation na to, part ng nursing. So ano yung statement ng pasyente? Ang nagsasabing effective ang kanyang home teachings or discharge instructions. Is it A, I'm happy to note that we can have sex occasionally when I have no bleeding. Ang galing. B, I am afraid I might have an operation when my due comes. C, I will have to remain in bed until my due date comes. D, I may go back to work since I stay only at the office. Your 5 seconds starts now. Alright, the answer to this is letter C. Nurses, kung hindi mo pa, kung gusto mo ng reviewer or better visualization ng placenta previa mo, ito po siya. Ang placenta previa, ito siya. Oh. Ito ang normal, correct positioning ng placenta. Kailangan hindi nakabalandra yung placenta. Saan? Sa mismong, o doon sa mismong vaginal canal kung saan lalabas si baby. Saan siya? Ang placenta previa nakabalandra dyan. Ang normal placenta kasi is naka-attach dito. Okay? Alright. So the answer to this is letter C. I will have to remain in bed until my due date comes. Ano to? Bed rest. Ang pinaka-ultimate advice sa mga pasyenteng may placenta previa. Placenta previa means that the placenta is the presenting part, meaning yun yung nauuna. On the first and second trimester, there is spotting. On the third trimester, there is bleeding that is sudden, profuse, and painless. Alright? Let's proceed. Board exam type of question number 3. The uterus has already risen out of the pelvis and is experiencing farther into the abdominal area at about the A, 8th week of pregnancy, B, 10th week of pregnancy, C, 12th week of pregnancy, D, 18th week of pregnancy. Your 5 seconds starts now. Alright, the answer is letter D. Now, 18th week of pregnancy, on the 18th week of pregnancy, the uterus, tinatanong ka ng placement ng uterus mo. Now, anong nangyayari sa 18th week of pregnancy? Ito, uterus is already risen out of the pelvis. That is your key term. Now, the uterus is still within the pelvic area. On the 10th week of the uterus is still within the pelvic area. On the 12th week, the uterus and placenta have grown, expanding into the abdominal cavity. On the 18th week, the uterus has already risen out of the pelvis and is expanding into the abdominal area. That's why the answer is 18th week. Risen out of the pelvis. Kasi nasa nag-expand na siya papunta sa abdominal area. Board exam type of question number 4. Which of the following urinary symptoms does the pregnant woman most frequently experience during the first trimester? Ano daw ang symptoms ang kadalasang nararanasan ng isang buntis during first try? Is it A, frequency, B, dysuria, C, incontinence, D, burning? Your 5 seconds starts now. Time's up. The answer is letter A, frequency. Madalas na pag-ihi. Pressure and irritation of the bladder by the growing uterus during the first trimester is responsible for causing urinary frequency. Dysuria, incontinence, and burning are symptoms associated with what? UTI. Kapag na-experience to ng pasyente mo, this is more likely uncommon because this will not really common, but this will signify what? UTI, urinary tract infection. Ano to? Frequency, madalas na pag-ihi. Kasi anong nangyayari? Mas nagkakaroon na dahil sa growing uterus during the first try, ano nangyayari? Mas kumikipit yung daanan ng ihi. Okay? Now, Question number 5. Mrs. Jimenez went to the health center for prenatal checkup. The student nurse took her weight and revealed 142 pounds. She asked the student nurse how much should she gain weight in her pregnancy. Gano daw kalala o gano yung magiging, how much is the weight gain in her pregnancy. So ang tanong kung gano kabiga yung dito approximation ng weight gain. Is it A, 20 to 30 pounds, B, 25 to 35 pounds, C, 30 to 40 pounds, or D, 10 to 15 pounds? Your 5 seconds starts now. Alright, the answer is letter B, 25 to 35 pounds. Or in kilograms, that's 11.2 to 15.9 kilograms. Now, this is currently recommended as an average weight gain in pregnancy, average weight gain. This weight gain consists of the following fetus, 7.5. So ito yung breakdown niya, kaya nagkaroon ka ng 25 to 35, ha? Sa fetus pa lang kasi 7.5 pounds, placenta is 1.5 pounds, amniotic fluid 2 pounds na yon, uterus 2.5 pounds, breasts 1.5 to 3 pounds, blood volume mo ng buntis is 4 pounds, total body fat mo is 7 pounds, and body fluid is 7 pounds. So kung ipag-add mo yon, it will the total summation on is 25 to 35 pounds approximation of weight gain during pregnancy. All right, let's proceed. Board exam type of question number 6. The nurse is preparing Mrs. Jordan for cesarean section. Which of the following key concepts should the nurse consider when implementing nursing care? Ano ang situation mo dito for CS ang pasyente mo? Is it A, explain the surgery, expected outcome, and kind of anesthetics? B, modify preoperative teaching to meet the needs of either a planned or emergency cesarean birth? C, arrange for a staff member of the anesthesia department to explain what to expect post-operatively. D, instruct the mother's support person to remain in the family lounge until after the delivery. Your 5 seconds starts now. Time's up. The answer is letter B. Why? So nurses, you need to modify your preoperative teaching to meet the needs of either a planned or emergency cesarean birth. A key point to consider when preparing the client for cesarean delivery is to modify the preoperative teaching to meet the needs of either planned or emergency cesarean birth. The depth of instruction will depend on circumstances and time available. All right, let's proceed. Question number 7. Bettine Gonzalez is hospitalized for the treatment of severe preeclampsia. Which of the following represents an unusual finding for this condition? Ano yung unusual? Pag sinabi unusual, hindi normal or unusual finding sa mga taong may preeclampsia. Is it A, generalized edema, B, proteinuria of positive 4, C, blood pressure of 160 over 110, D, convulsions? Your 5 seconds starts now. Alright, the answer is letter D. Unusual. Kadalaang tanong, hindi mo makikita sa preeclampsia kasi diagnosed na nga o nagre-receive na nga ng treatment si Bettine Gonzalez na may preeclamp. Ang hindi mo sasagutin ng A, B, and C because these are the findings of severe preeclampsia. Convulsion ang sagot dito. Bakit? Because this is a finding of eclampsia. Okay? Hindi preeclampsia, eclampsia na mismo. Which is an obstetrical emergency. Alright? So let's proceed. Board exam type of question number 8. Nurse Jelly explains to the client who is 33 weeks pregnant and is experiencing vaginal bleeding that coitus. Vaginal bleeding na ang pagtatalik ay, is it A, need to be modified in any way by either partner? B, is permitted if penile penetration is not deep. Ang galing. C, should be restricted because it may stimulate uterine activity. Or D, is safe as long as she is inside lying position. Your 5 seconds starts now. Sa mga nagtatalik, ito yung tanong na about sa mga nagtatalik during pregnancy. So the answer is letter C. should be restricted because it may stimulate uterine contraction or activity. Coitus is restricted when there is watery discharge, uterine contraction, and vaginal bleeding. Also, those women with a history of spontaneous miscarriage may be advised to avoid coitus during the time of pregnancy when a previous miscarriage occurred. Alright? Kasi ayaw mo namang ma-stimulate yung uterine contraction, hindi ba? Kasi pwedeng yun, lalo na kapag hindi pa niya kabuuan ng 33 weeks, oh. Is that full term? No, hindi pa yan full term. So ayaw mo naman manganak na maaga dahil lang hindi na mapigilan ng mga bagay-bagay. So itigil. Okay, the answer is letter C. Board exam type of question number 9. Mrs. Priscilla Abuela or Abuel, a 32-year-old multipara, is admitted to labor and delivery. Her last 3 pregnancies in short stage 1 of labor. The nurses decide to observe her closely kasi nga multipara. The physician determines that Mrs. Abuel's cervix is dilated to ilan na 6 cm. Mrs. Abuel states that she is extremely uncomfortable. To lessen Mrs. Abuel's discomfort, the nurse ano ang gagawin ng nurse to lessen Abuel's discomfort? You as a nurse can advise her to what? A. Lie face down. B. Not drink fluids. C. Practice holding breaths between contractions. Or D. Assume Sims possession. Your 5 seconds starts now. Alright, the answer is letter D. Assume Sims possession. Now, when a woman is in Sims possession, this puts the weight on the fetus on bed, not on the woman, and allows good circulation in the lower extremities. The answer is D. Board exam type of question number 10. Which is true regarding the fontanelles of the newborn? Tinatanong ka, alin dito ang totoo o ang fact about sa fontanelles of the newborn? Is it A, the anterior is large in shape when compared to the posterior fontanelle? B, the anterior is triangular shaped, the posterior is diamond shaped. C, the anterior is bulging, the posterior appears sunken. D, the posterior closes at 18 months and the anterior closes at 8 to 12 months. Nurses, your 5 seconds starts now. Time's up. The answer to this is letter A. The anterior is large in the shape or in shape when compared to the posterior fontanelle. The anterior fontanelle is larger in size than the posterior fontanelle. And additionally, the anterior fontanelle, which is diamond shaped, closes at 18 months, whereas the posterior fontanelle, which is the triangular in shape, closes at what weeks? 8 to 12 weeks. Neither fontanelle should appear bulging, which may indicate increased ICP, or sunken, which may indicate hydration or hydrocep. Alright? So, ang sagot is letter A. Nurses, nakakahinga pa ba? Galaw-galaw tayo, ha? Nangangalahati na tayo or more than nakakatsampung questions na tayo. Alright? I would just like to encourage you to please give this video a like para naman malaman ko kung nagugustuhan mo itong mga content sa channel ko, at pakishare na rin, itag mo na rin ako pag share mo siya, ha? Alright. So, let's proceed. Board exam type of question number 11. Mrs. Qui-Jones gave birth by spontaneous delivery to a full-term baby boy. Congratulations, Mrs. Qui-Jones. After a minute after birth, he is crying and moving actively. His birth weight is 6.8 pounds. What do you expect a baby Qui-Jones to weight at 6 months? Ano ang normal? Tinatanong ka lang dito kung ano ang normal weight ng 6 months old baby. Ano ang weight? Is it A, 13 to 14 pounds, B, 16 to 17 pounds, C, 22 to 23 pounds, or D, 27 to 28 pounds? Your 5 seconds starts now. Alright, the answer is letter A. 13 to 14 pounds. The birth weight of an infant is doubled at 6 months and is tripled at 12 months. Tandaan, yung birth weight ng patient, ng baby ay nadodoubled every 6 months ko. So, ang baseline mo is 6.8. I-doubled mo lang yan kasi naka 6 months na ang sagot, 13 to 14. After 12 months, matitripled naman itong 6.8 mo kung ito yung baseline weight mo sa baby mo, okay? So, malinaw yon. Let's proceed. Board exam type of question number Number 12, I'm sorry. During the first hours following delivery, the postpartum client is given IVF with what? Oxytocin added to them. The nurse understands that the primary reason for this is anong reason kung bakit nagbigay na ng oxytocin sa first hour following delivery. Postpartum na to ha, tapos na mga anak. Is it A, to facilitate elimination, B, to promote uterine contraction, C, to promote analgesia, or D, to prevent infection? Nurses, sasapoking kita. Ang gigigil lang sa mga nag-duty dyan sa OB ward. Sa DR. O, ano to? Your 5 seconds starts now. Time's up, nurses. The answer is letter B, to promote uterine contraction. Bakit? Para pag nag-contract, maiiwasan yung pagdudugo ni mami. To promote uterine contraction is the answer nga po. Bakit? Oxytocin is a hormone produced by the pituitary gland that produces intermittent uterine contraction, helping to promote uterine involution. Okay? Now, board exam type of question, number 13. Nurse Louise is assessing the newborn's heart rate. Newborn's heart rate, key term. Which of the following would be considered normal? Newborn's heart rate if the newborn is sleeping. Natutulog ang baby. Basically, ang tanong lang dito is normal newborn heart rate. Is it 80 beats per minute? Is it B, 100 beats per minute? C, 120 beats per minute? Or D, 140 beats per minute? Your 5 seconds starts now. Time's up. The answer is letter B, 100 beats per minute. 100 beats per minute is the normal heart rate for a newborn that is sleeping in approximately 100 beats per minute. If the newborn was awake, the normal heart rate would range from 120 to 160 beats per minute. Malinaw yon? Malinaw. Board exam type of question, number 14. The infant with Down syndrome should go through which of the Erickson's developmental stages first? So, ang key term mo dito, Erickson's developmental stages, first step or first stage. Pag ang pasyente mong may Down syndrome, Is it A, initiative versus self-doubt, B, industry versus inferiority, C, autonomy versus shame and doubt, or D, trust versus mistrust? 5 seconds starts now. Time's up. The answer is letter D, trust versus mistrust. The child with Down syndrome will go through the same first stage, trust versus mistrust, only at a slow rate. Therefore, the nurse should concentrate on developing a bond between the primary caregiver and the child. Board exam type of question, number 15. Hello, Galaw nurses. The child with phenylketonuria, PKU, must maintain a low phenylalanine diet to prevent which of the following complication? Ano daw ang complication ng phenylketonuria mo? Is it A, irreversible brain damage, B, kidney failure, C, blindness, or D, neutropenia? Your 5 seconds starts now. Alright, so ano ang iiwasan? Ano ang complication mo? Ito ay irreversible brain damage, retardation nga po. Kasi ano bang problema ng PKU mo na mga pasyente o mga pedia patients na may problema sa phenylketonuria? Diba metabolism, hindi yung katawan ng baby ay hindi nakakapag-metabolize ng alin? Ng phenylalanine, which is an essential amino acid. Now, kapag left untreated, that could lead to mental retardation. The child with PKU must maintain a strict low phenylalanine diet to prevent central nervous system damage, seizures, and eventual death. Alright? So let's proceed. Board exam type of question number 16. Which age group is with imaginative minds? Imaginative mind. Tinatanong ka anong age group daw kung saan napaka-imaginative yung mga pasyente mo. Creates imaginary friends. Is it A, toddler, B, preschool, C, school, D, adolescence? Baliw ka, girl, pag dumating ka ng adolescence, tapos may imaginary friend ka na lang, nako girl, medyo matakot-takot ka na, okay? Your 5 seconds starts now. Alright, the answer is preschool. During preschool, this is the time when children do imaginative play, The occurrence of imaginative playmates, dramatic play, where children like to act, dance, and sing. Diba sa mga preschoolers natin, doon mo makakita, minsan nagsasalita sila, minsan nagluluto-lutuan sila, nag-uusap sila. May kausap siya na parang mayroon talaga siyang kalarong iba. Yun yung imaginary friends nga na tinatawag, okay? But I want you to understand that is normal. As long as dun lang sa face na yun, hindi na yung tatagal pa. Nasa adolescence ka na, college ka na, may imaginative friends ka pa, nanggigigilak sa'yo. Alright? So, board exam type of question, number 17. Which of the following situations would alert you to potentially developmental problem with a child? Is it A, pointing to body parts at 15 months of age? B, using gesture to communicate at 18 months? C, typographical error, cooking at 3 months. Or D, saying mama or dada for the first time at 18 months. Alin dito yung abnormal, in short? Kapag nag-manifest ang isang bata ng alin dito yung kapag nagginawa ng bata, maa-alert ka kasi that tells you that there's something wrong. Your 5 seconds starts now. Time's up. The answer is letter D. Saying mama or dada for the first time at 18 months of age. A child should say mama or dada during when? 10 to 12 months of age pa lang. Options A, B, and C are all normal assessments of language development of a child. Okay? So yung mama and dada normally yung mga nauulit na words. Yung mga mama, papa, dada, mga ganyan, tata. Kailan yan? Ang normal yan is 10 to 12. Dito sa question, 18 months. So, delayed na yun. So, that's abnormal. Okay? Or based from the options, this is the finding na magsasabi sa'yo na abnormal. May something wrong. You need to be alert. Not really abnormal, but you need to be alert. Yun lang. Alright, 18. Isabel, a 2-year-old girl, loves to move around and oftentimes manifests negativism and temper tantrums. What is the best way to deal with her behavior? Best way to deal what? Negativisms and temper tantrums. Is it A, tell her that she would not be loved by others if she behaves that way? B, withholding giving her toys until she behaves properly. C, ignore her behavior as long as she does not hurt herself and others. Or D, ask her what she wants and give it to pacify her. Spoilin mo yung anak mo, girl. Okay, letter. Your 5 seconds starts now. Time's up. The answer is letter C. Best way to deal. Ignore her behavior as long as she does not hurt herself and others. If a child is trying to get attention or trying to get something through tantrums, ignore his or her behavior. Kasi pag ginawa mo to, ask her what she wants. Ano tawag dito? Malalaking spoiled naman yung bata, okay? Withholding, giving her toys, lalo magiging rebellious naman yan. Hindi niya masyado maiintindihan yan kasi 2-year-old lang. Tell her that she would not be loved by others. Ano to talaga, girl? Ginawa mo namang MMK. So, ang gawin mo dito, ignore mo lang so long na hindi niya sinasaktan yung sarili niya and the people around her, okay? So, let's proceed. Board exam type of question number 19. Baby boy Villanueva, a 4 months old, was seen at the pediatric clinic for his scheduled checkup. By this period, baby Villanueva has already increased his height by how many inches? So kapag 4 months old na ang baby, yun ang tanong, gano'n na siya katangkad? Ilan yung i-increase niya by 4 months old? Is it A, 3 inches, B, 4 inches, C, 5 inches, D, 6 inches? Your 5 seconds starts now. Time's up. The answer is letter B, 4 inches. So from birth to 6 months, the infant grows 1 inch, or equivalent nun sa centimeters is 2.5 per month. From 6 to 12 months, the infant grows 1.5 inch, or 1.25 centimeters per month. The answer is letter B. Board exam type of question number 20. Alice, 10 years old, was brought to the ER because of asthma. She was immediately put under aerosol administration of terbutaline. After some time, you observe that the child does not show any relief from the treatment given. Upon assessment, you notice that both the heart and the respiratory rate are still elevated and the child shows difficulty of exhaling. So you as a nurse will suspect what? Is it A. Bronchiectasis, B. atelectasis, lung collapse agad, C. epiglottitis, or D. status asthmaticus? Your 5 seconds starts now. Alright, the answer to this is letter D, status asthmaticus. Now, status asthmaticus leads to respiratory distress and bronchospasm despite of treatment and interventions. Mechanical ventilation may be needed due to respiratory failure. Okay? Now, bago lang tayo mag-proceed sa last 5 questions na nga tayo, please naman mag-comment ka sa baba at kung hindi mo pa nalalike tong video na to, hindi ka pa nagsusubscribe sa video ko, mag-subscribe ka na, okay? Help mo na sa akin at para malaman ko rin na may mga nakikinig. Huwag mo rin kalimutan na ilagay yung score mo sa baba, baby, okay? Alright. Board exam type of question number 21. Nurse Jonas assesses a 2-year-old boy with a tentative diagnosis of nephroblastoma. Symptoms the nurse observes that suggest this problem include, ano daw yung mga symptoms ng nephroblastoma? Is it A. lymphedema and nerve palsy? B. Hearing loss and ataxia. C. Headaches and vomiting. Or D. Nakalimutan ko isulat dito ha. D. Abdominal mass and weakness. Your 5 seconds starts now. Time's up, nurses. The answer is abdominal mass and weakness, letter D. Now, nephroblastoma or Wilms tumor is caused by chromosomal abnormalities. Most common kidney cancer among children characterized by abdominal mass, hematuria, hypertension, and what? Fever. The answer is letter D. Let's proceed. Board exam type of question number 22. Which of the following danger signs should be reported immediately during antepartum period? Is it A. blurred vision, B. nasal stuffiness, C. breast tenderness, or D. constipation? Your 5 seconds starts now. Time's up. The answer is letter A, blurred vision. Danger signs that require prompt reporting are leaking of amniotic fluid, blurred vision, vaginal bleeding, rapid weight gain, and elevated blood pressure. Nasal stuffiness, breast tenderness, and constipation are common discomforts associated with what? Pregnancy. So all of these three are normal except for blurred vision. All right? So that should be reported immediately. Board exam type of question number 23. Nurse Jacob is assessing a 15-month-old child with acute otitis media. Ano tong otitis media? Luga. Which of the following symptoms would the nurse anticipate finding? Is it A. periorbital edema, absence light reflex, and translucent tympanic membrane? B. irritability, purulent drainage in middle ear, nasal congestion, and cough. C. diarrhea, retracted tympanic membrane, and enlarged parotid gland. Or D. vomiting, pulling at ears, and purely white tympanic membrane. Nurses, I want you to take note of the age of the patient and the diagnosis. Acute otitis media. Paano magre-react ang isang pasyenteng 15-month-old kapag meron siyang otitis media? Your 5 seconds starts now. Time's up. The answer is letter B. Irritability, purulent drainage in the middle ear, nasal congestion, and cough. Irritability, purulent drainage in middle ear, nasal congestion, and cough, fever, loss of appetite, vomiting, and diarrhea are clinical manifestation of otitis media. Acute otitis media is common in children 6 months to 3 years old and 8 years old and above. Breastfed infants have higher resistance due to protection of eustachian tubes and middle ear from breast milk. Once again, the answer is letter B. Let's proceed. Last two questions na nurses, hinga-hinga. Which of the following is the most appropriate intervention to reduce stress in a preterm infant at 33 weeks gestation? Nurses, I want you to take note of the 33 weeks gestation, okay? Anong tanong? Best answer. Most appropriate intervention mo to reduce what? Stress sa preterm infant. Alright. Is it A, sensory stimulation including several senses at a time? B, tactile stimulation until signs of overstimulation develop. C, an attitude of extension when prone or side-lying. Or D, kangaroo care. Your 5 seconds starts now. Alright, the answer to this question is no other than kangaroo care. Sa mga hindi nakakalam ko anong kangaroo care is the use of skin-to-skin contact to maintain body heat. Di ba ginagawa na to sa mga unang yakap ng DOH? Isa na ito talaga sa mga pinoprotocol. Nung last kong duty sa DR, ginagawa na namin to. Now, this method of care not only supplies heat but also encourages parent-child interaction. Alright? Last question na. Board exam type of question number 25. The parent of a client with albinism would need to be taught which preventive healthcare measure by the nurse. Anong patient mo dito? Albino. Is it A, ulcerative colitis diet? B, use of high SPF sunblock? C, hair loss monitoring? D, monitor for growth retardation? Your 5 seconds starts now. Make it good. Make this last question count, okay? Begin. Time is up. Letter B is the answer. Use of high SPF sunblock. Bakit? Without melanin production, the child with albinism is at risk for severe sunburns. Maximum sun protection should be taken, including use of hats, long sleeves, minimal time in the sun, and high SPF sunblock to prevent what? Any problems on the skin. Alright, nurses, tapos na nga tayo, ha? Thank you so much for watching and tuning in at sa pagsagot kasama ko. Please like, share, and subscribe to my channel kung hindi ka pa nagla-like, kung hindi ka pa subscribe for more nursing educational videos. Let me know if you have other nursing topics that you want us to cover. I will be more than happy to do that for you. Abangan mo yung mga next video natin regarding sa playlist na to, ha, entry natin sa nursing test banking. Alam ko na napakarami na matututunan, napakarami ang matutulungan ng video na to. Hindi lang yung mga magte-take ng Philippine Nursing Licensure Examination, kasi gagawa rin tayo ng mga contents na that will cover questions na pwedeng lumabas sa NCLEX, sa DHA, sa HAAD, sa CBT, all of those examinations na meron tayo sa nursing. Pakilagay po ulit yung score sa baba, ha. I will be more than happy to evaluate your scores, and share mo na to para mas marami tayong matulungan, lalong-lalo na yung mga magte-take ng board exam ngayong darating na Mayo. Once again, good luck, ha. Tulungan mo na nga ako ipamalita sa Radyong Sira, ang pinakabago, pinaka-fresh, pinakamasaya at ang pinakalibreng nursing review center sa balat ng YouTube. Thank you so much, nurses, for watching. I hope you learned something. Help me grow my channel. You are already here. You might as well subscribe. #TeamCoolTalk. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out the other playlists I created for you. I'll be putting the links on the description box, or simply click this icon button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Galve, and I'll see you again.